Hi, welcome. Today we're going to be presenting about whole person care orchestration. My name is Jennifer Bowers, and I am the Managing Director of Clinical Strategy at Dataluz.
And I'm Gabriel Moss, Senior PM and Product Alliances Manager at Microsoft.
Today we're going to talk about our flagship interoperability tool, which is called DC4H. And we're going to talk about Dataluz, and one of the things that we like to talk about is how you pronounce it. And it is data loose, and the reason, the easy way to remember it is that we set your data loose. We are also one of the largest global purely healthcare corporations globally that nobody's ever heard of in the United States. So today we're going to talk through the life of JJ. And who's JJ? He's a 10-year-old boy struggling with many things. He has some health issues. He was diagnosed at 5 with autism and ADHD, at 7 with asthma. He lives in a neighborhood that's a little rough. They have some food insecurity, and he's struggling in school. So we're going to talk about how Dataluz, in partnership with Microsoft, are able to help him in his life. So why Dataluz for interoperability? So again, as I mentioned, we're one of the largest global purely healthcare software companies globally. We service over 6,700 healthcare organizations. And our data passes through over 540 million lives a year. Why are we unique? We think it's so important that into healthcare you bring in what goes on outside of healthcare. So in the clinic is a very small sliver of what is done in a patient's care. And what we think is really the environment is so important to take into account, especially with somebody like JJ who has asthma. One of the most important things is the environment, with the air that he's breathing and how that affects his health care. And because of that, and because it's Earth Week, we're planting a tree for everybody we meet here at HIMSS. So what is whole person care orchestration? And I just love this slide and the way it really represents that. In the middle you'll see the clinical setting, but what's really important is all of that information that comes together, the social determinants of health, what JJ's doing at school, what he's doing in his therapist's office, and all of those things bringing it together. And how do we do that? One of the things that we talk about with the Dataluz way is that we really want to impact lives from birth to end of life. We use our predictive analytics tools along with our partners to be able to predict what might happen, and for those things that aren't predictable, we support with care. You'll see on the left-hand side of this slide that we represents our partnership with Microsoft, which we'll talk about a little bit more in a minute. So this is just an architecture slide. Dataluz is represented in blue and Microsoft in green. On the left-hand side, this is where we bring in all those systems of records with our connections. That middle piece is the DC4H tool that I was talking about, and I'll talk about that a little bit more in a minute. And then in the top left is that care management tool to really help JJ through his issues. And that was built in collaboration with another one of our partners, RX Health. And I'm going to turn it back over to Gabe to talk a little bit about how we work with Microsoft.
Thanks. This is actually a phenomenal use case for some of the things that we see as big barriers in the healthcare industry as a whole. Microsoft obviously is a platform company that really scales horizontally, but is really in the healthcare space focused on data interoperability and building all of the tools needed for companies like Dataluz and our key partner to go ahead and actually get the information to where it's needed most, which is in the hands of providers. There's a lot of those capabilities buried within our platform that Dataluz is actually taking advantage of here, whether it's virtual machines or Kubernetes services, as well as with our applications that are brought to bear from our Nuance acquisition. All of those are actually applicable for this use case and for JJ. Like she mentioned, one of the key things that healthcare is trying to tackle is preventative medicine and preventative care. A lot of that comes about in the generation of new AI predictive models, whether that might be from clinical information from like a FHIR HL7 repository, or medical imaging, where you're pulling in multimodal medical imaging data, curating it, and getting it ready to actually do clinical decision support making for a clinician at the point of care, highlighting what could be a life-threatening tumor or ulcer that might get missed by radiology. And that's actually some of the Nuance Radiology Copilot stuff that we're currently working on today. Additional capabilities that would be used in a use case like this are Teams, Outlook, and our typical productivity suite. as well as Power BI for clinical analytics, as well as operational analytics in a provider all-up healthcare scenario or application.
So I'm going to talk on the next slide about that middle layer that we see here, which is our DC4H, or our Digital Connect for Health platform. So we like to talk about this as the 6 pillars of value. We start on the left-hand side with integration. So we can't do anything unless we integrate. We've got a very vast portfolio of adapters that we can use to do that integration. And then we move on to ingestion. And we can ingest any sort of healthcare data, from documents to CDAs to HL7 to FHIR, because then in the next pillar, we index and we normalize that data and we turn it all into FHIR. So this is, a lot of companies do what we do here on the left. I, of course, think we do it better, but what is really cool about what Daedalus is doing is what happens on the right-hand side of this slide. So what we're doing now is then gaining insights to be able to inform and intervene. So some of the things that Gabe talked about with those analytics tools we're using in here to be able to take all of this rich data and really figure out what we need to do even before that point of care to inform the clinicians as to what they need to do. We actually have a tool that also can take all of this rich data and screen people for clinical trials. So we're able to put in inclusion and exclusion criteria and pull from all this vast data that we have to really match the right person to the right clinical trial. Here you can see some of those dashboards on our analytics that we have within the tool. Some other information in here is the consent management that we do and the care planning. And so why Daedalus and Microsoft? We like to talk about it as an exponential relationship. The 1 + 1 = 4. It might not be great math, but it's a great relationship. On the left-hand side are the Daedalus tools, that connected care platform that we've been talking about, the whole person care orchestration platform that we're going to show in a little bit. But we also have enterprise scheduling, a patient-facing tool, healthcare content management. I already talked a little bit about our clinical trials tool. And we've also just developed an organizational command center tool that allows people to see the inefficiencies in their organization. And now Gabe's going to tell us a little bit about the Microsoft tools.
And so Microsoft obviously brings a lot of the capabilities of a hyperscaler. So what that means is Microsoft as a cloud provider can build and provide a lot of the platform tools needed to actually scale this at a global level. So we have Azure Health Data Services, which is our interoperability suite based in MedTech, DICOM, FHIR, and HL7 converters. That is available globally in all of our subs and all of our data centers, as well as in, we're actually adding new capabilities to that. Currently, it's a fully GA service. And hyperscale cloud really allows companies to control for their fixed costs and move into more of an OpEx model, right? So it really can help a balance sheet. Additional capabilities and things and advantages that you get from using Microsoft Cloud include all of our NLP, AI, and ML tools. NLP is natural language processing. A lot of those tools, right, like text analytics for health, allow you to pull in unstructured text data, structure it, including negation, for a clinical use case, and extract that either as a FHIR or JSON file for additional secondary use analytics on top of that. There's also IoT and IOMT capabilities within Azure natively. That includes the ability to pull in from multiple different types of wearables devices as well as medical devices, including pacemakers and other orthopedic smart implants that we've actually had several partners and customers start to leverage. All those things allow Microsoft to offer the needed platform and tools for Daedalus and others to build what's needed to actually manage cases like JJ.
All right, so what are the benefits of this great partnership? So innovation, certainly. We're both two very large corporations that are highly innovative, and we bring all of that together. Expertise. We've been doing purely healthcare software for over 40 years. Microsoft is huge in the space, so we bring all of that expertise together for our customers. We are both very agile, so we bring agility. We also allow you to free up attention in your organization by taking over a lot of those processes that you would normally do. And we have a lower cost model together.
Nuance specifically as part of Microsoft now, with the acquisition about 18 months ago, brings a specific set of voice-to-text applications as well as capabilities based in AI and focused in the healthcare and life sciences space that's really second to none. starting with their Dragon Medical One product, which is a cloud-based conversational AI workflow assistant to really help clinicians at the point of care to not spend so much time doing documentation and note-taking. A lot of clinicians, right, talk about pajama time, which is this idea that after you're done with a shift, you go home and you actually have to catch up on all of your notes from throughout the day, which adds a lot of unneeded stress and burden to doctors and nurses everywhere. Dragon Medical One, Virtual Assistant, Dragon Medical Speech Kit, and PowerMight Mobile, as well as DAX, are all solutions that are part of Nuance that are really focused on relieving that clinician burden with documentation and note-taking by using voice-to-text AI capabilities and language models to really assist with all of those workflows. Those workflows and that data can actually get structured within Azure and be fed through Synapse, as well as other connectors to Power BI and other analytics tools within Microsoft and Azure for additional use cases, like I've mentioned before, for generative AI, diagnostic decision support, model making, as well as dashboards for operational workflows, as well as like patient care management.
Using Nuance is especially important for a child like JJ, who struggles with autism and ADHD, who can't necessarily focus as well. So when he's in the provider's office, being able to have the provider make eye contact and really create a bond between JJ and his providers is great, and it takes away that time that they'd be typing on their laptop. So the other partner that we have is RX Health, and what they've done for us is to help us to develop the tool that we're going to show a video of in just a moment, which is that referral management tool that's really helping JJ. So a little bit more about JJ. So JJ has a revolving wheel of challenges, and this is what we're really working to get rid of. The fact that he has poor nutrition, he has the medical issues that he has, he's being bullied at school. English is his second language, and it's a low-income household. So what are we going to do about that? So we're going to use that care coordination tool that we're going to show in a moment. We're going to provide JJ with a care manager. We're going to go through his social determinants of health, figure out what the needs are for JJ and his family. So one of the tools that we have is an enterprise scheduling tool. So for all of those appointments between therapists and doctors and specialists that JJ has to see, JJ's mom can then schedule appointments on her own time when it makes the most sense for her. One of their issues is that she's struggling to hold down her job that does cover their insurance, and she can't be spending all day on hold making appointments. She can then see those appointments on the consumer-facing app. In addition, she can also see JJ's medical records, his medications, conditions, and allergies so that she can easily share them to the school, to a summer camp. She has them right in the palm of her hand. There's also notifications here. So right before JJ has an appointment, she's going to get a notification to remind her to fill out some forms, which she can then do right here in the app. That way, again, she can do it on her own time, but it also really helps with operational efficiency in the provider's office because having those forms done ahead of time, they can be reviewed ahead of time, and it doesn't hold up appointments. So I'm going to go ahead and show a video of what that care management tool looks like. What you'll see here is the view for a care manager. On the left-hand side, you'll see the navigation that allows me to see all the things that I need to see for my members. So this is where I can sign a new member up, where I can go in and look at all the things that I need to do. In the middle here, you'll see any overdue tasks, things that I need to get done for the members. And on the right-hand side, a calendar of all the appointments that I need to be involved in. And if we drill into one of those, we'll just kind of see the what and the where of that appointment. And then we're going to go to the upper right-hand corner. And there's a couple things here. The first thing is the notifications. So this allows me to see right away what needs to get done. I also have here a tab for my tasks. So when I get there every day, I can see exactly what needs to get done. And then a list of my members. So you'll see here a couple of things, a little demographic information, contact information, and that color coding. And what that means is once we've gone through those social determinants of health, we're going to figure out how in-depth we need to go into these clients and help them. So we'll go ahead and look at JJ. So we'll go ahead and go into his record, and what we're going to see on the top is a little demographic information, the contact information. And then we'll go into that social determinants of health assessment, which is so key to managing JJ. So you'll see here the list of questions that we have in the social determinants of health questionnaire. On the right-hand side, any notes that I need to add regarding that question. And then in the middle, whether or not we're assisting JJ and his family on this particular issue or not. And if we are assisting, this is what then informs that plan of care. So we're going to go ahead and look at that plan of care now. And what you'll see is that this is a true referral management system. It tells us the issue and which social determinants of health question it relates to. We can pick where we want to refer this patient to, put some dates around it. When's the target date? What's the completion date? And then all the way on the right-hand side, what you'll see is a record of whether or not this referral has been sent. So let's go back to JJ. So we talked about that revolving wheel of challenges that JJ has, and what we really wanted to do is break that revolving wheel of challenges with our tools so that JJ can have a good diet here. He does better in school. He's able to be a kid and not focus so much on his health care. He's able to actually go out and play ball and be a 10-year-old. Thank you.